Hi, I'm Dr. David Greene, CEO of Preferred Pain Center here in Phoenix, Arizona. Today I'm out at the Phoenix Mountain Preserve, and the reason that I'm here is because it's 110 degrees today, so I thought I would come out and talk about the desert weather and how many days it gets really hot out here. Well, the average is 19 days that it gets over 110 degrees in Phoenix. Today's one of those days. The hottest it's ever been in Phoenix is 122 degrees, and that was back in 1990. Well, then I thought, what's the coldest? The coldest was back in 1913, about 100 years ago almost, 16 degrees. So it does get very cold. People don't understand that, especially at night, because it's very non-humid. So at night, there really isn't anything holding in the heat. But the average number of days that it gets over 100 degrees here in Phoenix is 19. The average days of sunlight per year is over 315. And very quickly, what is a haboob? A haboob is H-A-B-O-O-B. It's very common in the Middle East as well as dry, arid areas like Phoenix and desert. And what happens is a thunderstorm is forming. Normally winds come into the thunderstorm or they go behind it. But when the precipitation actually starts, wind is forced out of the thunderstorm, oftentimes ahead of it. And it can go 20 to 30 miles per hour and hit down and lift up dust and create a huge dust storm that can be up to 60 miles wide and a couple miles high. And we had a huge one this summer. You can find it on YouTube. It's a very impressive sight. Anyway, the topic for today is the top 5 pain management advances in the 21st century. So I looked at all the literature and all the things that are being done in pain management and what is being advanced upon or represents new technology that is starting to potentially change the field of pain management. Well, number one, and I'll start with what I feel is the most disruptive technology, is regenerative medicine. Regenerative medicine is very important coming up and potentially represents a holy grail in pain management. The reason is because right now the treatments that are done are just placating pain. They're a big band-aid, which is very important, but they're not changing the disease. Regenerative medicine has the potential to do just that, regenerate tissue, help it heal better and faster, and maybe change the course of arthritis, maybe help regenerate the intervertebral disc, those types of things. So we do have some technology available right now. Preferred Pain Center has this. It's an amniotic-based substance for injection that contains cytokines, hyaluronic acid, has some stem cells in it, and it does represent, and we're having good results with it so far. So regenerative medicine is by far and away number one on the list. Number two, I would put at spinal cord stimulation. Spinal cord stimulators have been around for a long time, but the last 10 years have seen this type of exponential increase in how good they are, how well they work, and the form. So it's not just function, but form as well. They've gotten a lot smaller. So they've gotten smaller and the batteries have gotten better. A lot of times patients can recharge themselves while they're asleep outside the skin with a belt around the torso. And the battery can last for up to 25 years now, whereas it used to be where it was one battery, you couldn't recharge it. When it was done, you needed another surgery to replace it. So that's gotten a lot better. The other thing is the paddles that go around the spinal cord have gotten better with the programming. So it used to be very limited. You could only put a few programs into it. Now they have like remote controls outside the body where you can change the programming so you can get better pain relief for, say, a person's outside of his left leg, or also the right leg, or the groin as well. They can program these diodes on the paddle to give better pain relief, and you can change that any day of the week. So it's remarkable what they've been able to do with spinal cord stimulators. So the third thing that I think is extremely important in the same vein as spinal cord stimulators, radiofrequency ablation. It's also called radiofrequency neurotomy, radiofrequency denervation. But essentially what's happening is pain doctors do this as an outpatient procedure, and patients will get 2 or 4 needles under excellent numbing into either their neck or their back, wherever the problem is, And the needles, the tip of it heats up and deadens the tiny little nerve endings that are causing pain to the joints. And you don't need those tiny little nerve endings for motor function or anything like that. They're tiny, and they go, if they get deadened, the pain can go away. And this can last for 1.5 years. We've heard about it up to 2 years, but a lot longer on average than a typical injection. And then those little nerve endings grow back, and the pain can come back along with it, and you can just have it repeated. So it represents a huge technological advancement in pain management, and is very popular right now. There's a lot of research to back it up. So the fourth thing I wanted to mention is basically a keyword: education. You know, there's always been education available to patients with regards to pain management conditions, but now with not just the internet, but all the things available on the internet. Like, look at our website, preferredpaincenter.com. There's a page on education that has a series of animated videos that are written for patients, and they show as well as explain all these different pain management conditions and the treatments. It's remarkable what's available to patients. And what it does is it allows individuals to become an active participant more often in their care, which can lead to better results because patients understand their conditions and the treatment and what to expect. So it helps manage expectations as well. So number 5, and one of those last but not least things that I wanted to mention is imaging, better imaging. And here's what I mean by that. Pain doctor's doing an injection, let's say, on your back, and he's putting a needle around the spinal cord and around the nerve root to put some medication to help relieve pain. Don't you want him or her to have the best image that he or she can have to improve accuracy? Well, the machine's called a fluoroscopy. It's a real-time x-ray machine, and the images over the last 10 years have gotten a lot better. So it can increase accuracy of where that needle's going. Also, MRIs have gotten better, CAT scans, the algorithms with the software have gotten better. So radiologists and pain management doctors can see what's going on with your back or neck or wherever the part of the body is just better. And that can lead to better diagnostic considerations, better treatments, and better outcomes. So there you have it. There's the top 5 pain management advances in the 21st century. Check out our website at preferredpaincenter.com. Not only do we offer a 24-hour guarantee of getting you in as an initial patient, we also now have a free introductory 30-minute massage for patients who are being seen for pain conditions. So it's a great free service, no obligation. I'm Dr. David Greene, Preferred Pain Center. Your pain stops here.